Hello everyone, welcome to the Victory Education Lounge where we help you ace your medical residency interviews. Today we're tackling a question that often comes up in these interviews. Can you provide an example of how you work in a team? Now, this question may seem straightforward, but it's packed with deeper implications. Let's take a moment to understand what's really going on here. So, if you're ready to embark on this exciting phase of your medical career, don't forget to hit the like button, subscribe for more content, and share your thoughts or questions in the comments below. Let's dive into the world of residency interviews and move one step closer to your residency goals. When interviewers ask this question, they're not just looking for a story about a time you worked in a team. They're trying to get a glimpse of your teamwork skills, which are absolutely vital in a medical setting. They want to know how you handle collaboration, how you communicate with your colleagues, and how you resolve conflicts when they arise. They're also interested in your ability to reflect on your experiences and learn from them. Think back to your time in medical school or even during your internships. Can you recall an instance when you had to collaborate with your peers to achieve a common goal? Or perhaps a time when you had to resolve a conflict within a team? These are the kind of experiences you should consider when answering this question. But it's not just about recounting a story, it's about demonstrating that you're a team player who can communicate effectively, resolve conflicts, and contribute positively to a team. It's about showing that you're not just a solitary worker, but someone who can thrive in a team setting. Now, when crafting your answer, it's important to remember these key elements. Think about how you can demonstrate your ability to collaborate, communicate, resolve conflicts, and reflect on your experiences. It's not just about telling a story, but about showing the interviewer that you possess these crucial skills. So as we move forward, keep these points in mind. Remember, the question is not just about providing an example of how you work in a team, it's about showcasing your teamwork skills and demonstrating that you're a valuable asset to any medical team. When crafting your answer, think about these key elements. When answering, it's helpful to use the STAR method: situation, task, action, and result. This is a universally recognized strategy for answering behavioral interview questions, and it can be particularly effective when discussing teamwork. Let's break down each part of the STAR method. Situation is where you set the scene. You need to provide enough detail for the interviewer to understand the context. This could be a challenging case you faced during your medical training, a group project in medical school, or any other team-based experience. Next, we have task. Here you should clearly define your role within the team. What were your responsibilities? What was expected of you? This is your chance to show that you understand the importance of individual roles within a team. The action part is where you describe what you did. How did you fulfill your role? Did you face any challenges? If so, how did you overcome them? Remember, the focus here is on you. Even if you're talking about a team effort, the interviewers want to know about your specific contributions. Finally, we have result. This is where you discuss the outcome of your actions. What was the end result of the team's efforts? How did your actions contribute to this? If possible, try to make this result quantifiable. For instance, our team's efforts led to a 20% reduction in patient recovery time. This method helps you structure your answer clearly and effectively. It ensures you cover all the essential points without getting sidetracked. It also helps you emphasize your role and the positive impact of the team's collaboration. One last tip: practice makes perfect. Try to prepare a few examples using the STAR method ahead of your interview. This way you'll be ready to shine when the interviewer asks, "Can you provide an example of how you work in a team?" Remember, the focus is on your role in the team and the positive outcome of the collaboration. Let's go through our first example. Imagine you were part of a team managing a high-stress emergency situation. A situation like this requires fast thinking, quick decision-making, and impeccable teamwork. You might start by saying, "During my rotation in the ER, we had an influx of patients due to a major accident." That sets the stage. Next, outline your task. You could say, "As part of the response team, my task was to triage the incoming patients and assign them to the appropriate care team." This shows your ability to prioritize under pressure. Then, dive into the action. Describe how you communicated effectively with your colleagues. You might describe how you used clear, concise language to relay patient information, or how you listened actively to ensure you understood instructions from senior staff. You could say, "I made sure to clearly communicate the patient's condition and potential needs to the rest of the team, ensuring everyone was on the same page." Now, talk about the delegation of tasks. You might explain, "Recognizing my colleagues' strengths, I assigned tasks that suited their expertise, ensuring a smooth workflow under high pressure. This shows your ability to utilize team resources efficiently. Finally, bring it home with the result. You could say, because of our effective communication and task delegation, we were able to manage the situation efficiently, providing care to all the patients in a timely manner. This demonstrates the positive outcome of your teamwork, a successful patient outcome. This example shows your ability to work under pressure and communicate effectively. It showcases your understanding of team dynamics and the importance of assigning the right tasks to the right people. And most importantly, it highlights the positive impact of good teamwork on patient care. Remember, the aim here is not to show off but to demonstrate your ability to work effectively in a team, a skill that is vital in a medical setting. So, keep it real, keep it focused, and keep it relevant. For our second example, consider a time when you were part of a research project. This scenario is a common one in the medical field and touches on several key teamwork skills. Picture this. You're part of a diverse team tasked with conducting a critical research study. The team consists of individuals with different expertise, backgrounds, and perspectives. It's a melting pot of knowledge, but it also presents a unique challenge. How do you effectively collaborate to reach a common goal? In this situation, your task is to contribute to the team's collective effort. You're responsible for collecting and analyzing data, coordinating with team members, and ultimately, contributing to the research findings. Now let's talk about the actions you took. You actively sought to understand the perspectives of your team members, valuing their unique insights and expertise. You communicated effectively, ensuring everyone was on the same page and contributing to the project's success. You took responsibility for your role, diligently collecting and analyzing data, and sharing your findings with the team. Lastly, let's look at the result. Your team's research contributed to a better understanding of a medical condition, potentially leading to improved patient care. The diverse perspectives within your team led to a comprehensive study, and your collaborative efforts ensured the project's success. This example demonstrates your ability to work with diverse teams and contribute to the medical field. It shows that you value the unique insights and perspectives of your team members, and that you're capable of contributing significantly to critical research. So, when you're faced with the question, can you provide an example of how you work in a team? Remember this scenario? It's a powerful example of teamwork in action. In our third scenario, think about a time when conflict arose in your team. It's inevitable, right? When different personalities and ideas converge, sparks can fly. But guess what? Interviewers love this scenario. It's a perfect opportunity to showcase your conflict resolution skills and ability to strengthen team dynamics. So, let's dive into crafting our answer. Remember, we're using the STAR method. Start by setting the scene. Maybe it was during a challenging clinical rotation or a high-stakes research project. The key is to convey a real sense of tension, a situation where teamwork was crucial to success. Then, move on to the task. What was the team's goal? What was the conflict that emerged? Maybe two team members had differing opinions on the best course of action. Maybe there was tension due to the stressful environment. Whatever it was, make sure to highlight the potential impact on the team's performance and project outcome. Next, we move on to the action. This is where you shine. Describe the steps you took to resolve the conflict. Did you facilitate a discussion between team members? Did you propose a compromise or a new approach? Or maybe you helped the team members see the situation from each other's perspective. The key here is to demonstrate empathy, diplomacy, and problem-solving skills. Lastly, the result. What was the outcome of your actions? Ideally, your efforts led to a resolution of the conflict, a more cohesive team, and a successful project outcome. But even if the result wasn't perfect, it's important to show that you learned from the experience and took steps to prevent similar conflicts in the future. This example highlights your conflict resolution skills and ability to improve team dynamics. It shows that you're not just a team player but also a team builder. And that's exactly what your future residency program is looking for. Example 4 could involve an interdisciplinary team. Now this is where you can really shine by demonstrating your ability to adapt and innovate. Picture this. You're part of a team that includes not only doctors but also nurses, social workers, and even nutritionists. This diverse team is tasked with creating a holistic treatment plan for a patient with multiple coexisting conditions. Your role in this team is to provide the medical perspective, but you also have to take into account the insights of your colleagues from other fields. Start your answer by setting the scene. Describe the patient's complex condition and the need for a comprehensive, interdisciplinary approach. This is your situation. Next, move on to the task. You were not just there to provide a medical solution. Your task was to collaborate effectively with professionals from other fields, understand their perspectives, and integrate their expertise into the treatment plan. Then, delve into the action. Maybe you had to adjust your initial treatment plan after discussions with the nutritionist or social worker. Perhaps you organized regular meetings to ensure everyone was on the same page, or you created a shared platform where everyone could update their progress and feedback. Finally, reveal the result. Did the patient's health improve? Did this interdisciplinary approach lead to a more effective treatment plan? Did it maybe even change how you approach patient care in general? Remember, the goal here is to showcase your ability to work in diverse teams, your adaptability, and your innovative thinking. You want to show that you can not only respect and learn from the expertise of others, but also integrate it into your own work to achieve the best patient outcome. This example shows your ability to adapt to different perspectives and think innovatively. Lastly, talk about a time when you took on a leadership role within a team. This example is particularly powerful because it not only demonstrates your ability to work within a team, but also your capacity to guide and motivate others. Let's construct an answer using the STAR method. Picture a situation where you were appointed the leader of a team tasked with implementing a new clinical protocol. This is your situation. The task was to ensure the protocol was correctly and efficiently implemented, while training the team to adapt to the new procedures. Moving on to action, discuss your leadership approach. Perhaps you started with a team meeting to discuss the new protocol, making sure everyone understood the changes and their roles in executing them. You might have also set up training sessions for team members, ensuring they were comfortable with the new procedures. As a leader, you had to be the mediator, the motivator, and the enforcer, ensuring everyone was on the same page and working towards the same goal. Finally, we come to the result. Discuss the successful implementation of the new protocol and how it improved the team's efficiency or patient care. Maybe you saw a decrease in patient wait times, or an increase in team morale. Perhaps there were fewer errors, or an increase in positive patient feedback. The key here is to highlight the positive outcome that resulted from your leadership. This shows not only that you can work within a team, but also that you have the ability to take the reins and guide a team towards success. You should also mention if you received any positive feedback from your superiors or peers, as this further reinforces your ability to lead. Remember, the goal is to provide an example that showcases your teamwork skills, but also highlights your leadership abilities. This example demonstrates your leadership and mentorship abilities, as well as your capacity to drive success. Thank you for watching. We've covered a lot today, from understanding the essence of the team-based question to crafting a strategic answer using the STAR method. We journeyed through 5 diverse scenarios, each designed to highlight different aspects of teamwork. From managing high-stress situations and navigating team conflicts to leading a project and working in interdisciplinary settings, we've seen the many faces of teamwork in a medical context. Remember, the key is to showcase your ability to collaborate, communicate, and contribute effectively to a team. Reflect on your experiences, learn from them, and use them to paint a vivid picture of your team-based skills. We hope these examples have given you the confidence to tackle this common question in your interviews. As you embark on this exciting journey, remember that preparation is key. Take your time, be thorough, and most importantly, believe in yourself. You've come this far, and a rewarding career in medicine awaits you. Now that you're ready to embark on this exciting phase of your medical career, don't forget to hit the like button, subscribe for more content like this, and share your thoughts or questions in the comments below. Let's dive into the world of residency interviews and move one step closer to your residency goals.